What is reflux?
So reflux is the action of acid content in the stomach and other substances in the stomach coming up into the esophagus, which lays in the chest above the diaphragm. And that can happen for a variety of different reasons.
The stomach usually acid?
Acid, protein, food content, a lot of things mix in there because the stomach basically digests that food and grinds it and gets it ready for the small bowel.
So normally when we swallow, the food goes down the stomach and usually it stays there.
That's correct.
What makes it reflux?
So if somebody has a stomach that's been overfilled because they've overeaten, if they have had difficulty with chemical substances that potentially affect the valve at the bottom of the esophagus, which is called the sphincter muscle, that could come from nicotine use, caffeine intake. If they have a hiatal hernia, which is an anatomic change in the area where the esophagus and the stomach join together, it happens to converge right at the diaphragm, but if that's disrupted and some of the stomach moves up into the chest, then you can have a hernia which disrupts that valve as well.
So the diaphragm is right below the chest, so I take the area we're talking about is right at the bottom, or right where the diaphragm is, which is very, very prone to getting pressure in the belly that pushes the food up to the throat.
That's correct, yeah.
What kind of symptoms does it give?
So people with reflux or gastroesophageal reflux disease, where it happens frequently and is classified as a condition, often complain of symptoms like heartburn or a burning sensation underneath the sternum.
Isn't that scary?
It can be, especially if it's associated with more intense chest discomfort, because it can sometimes be confusing for heart pain as well. And then sometimes people will complain of a sensation that liquid content is coming up the esophagus, maybe into the back of the throat, and that's called regurgitation.